Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Child undernutrition linked to global measles outbreak, study finds. New research suggests that undernutrition may be exacerbating measles outbreaks in areas suffering from food insecurity. A study involving over 600 fully vaccinated children in South Africa found that those who were undernourished had substantially lower levels of antibodies against measles. Researchers tracked the children's growth over time as an indicator of undernutrition and measured their antibody levels through blood tests. Does calorie labeling on food menus lead to fewer calorie consumption? A new Cochrane review has found that calorie labeling of food on menus and products leads people to choose slightly fewer calories. The research team examined evidence from 25 studies on impact of calorie labeling on food selection and consumption. They found that calorie labels in supermarkets, restaurants, and other food outlets led to a small reduction in the calories people selected and purchased. The average reduction was 1.8%. which would equate to 11 calories in a 600-calorie meal or around 2 almonds. The new update compiles evidence from 25 studies with a strong emphasis on real-world field settings, with 16 of the studies being conducted in restaurants, cafeterias and supermarkets. The studies that were analyzed encompassed over 10,000 participants from high-income countries including Canada, France, the United Kingdom and the USA. Excessive weight gain early in pregnancy may contribute to fetal fat accumulation, researchers. Fetuses of pregnant people who gain excess weight in the first trimester of pregnancy show signs of excess fat distribution in the upper arm and in abdomen, according to a study by researchers at the National Institute of Health. These findings may inform efforts to prevent excessive weight gain early in life, a risk factor for adult obesity and related conditions such as heart disease, high blood pressure, and diabetes. The study appears in the American Journal of Clinical Nutrition. The authors analyzed data from an earlier study of more than 2,600 singleton pregnancies, which included information on maternal weight before and during pregnancy and 3-dimensional ultrasound scans throughout pregnancy. Global trial shows underestimation of cardiovascular risk in HIV patients. A new study has found that for people with HIV, current risk models underestimated cardiovascular events in both women and black men in high-income countries. Their findings are published in Lancet HIV. Researchers conducted a study to evaluate how well existing atherosclerotic cardiovascular disease risk estimates could be used to predict cardiovascular outcomes in global populations with HIV. Their prospective cohort study used data from randomized trial to prevent vascular events in HIV, Reprieve trial, to analyze individuals with HIV who were from low, middle and high income countries across several continents. Researchers found that for those in Reprieve trial. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.